Hello and welcome back to the channel. If it's your first time here, my name's Lee. We're on this channel with my son Ollie. We're based currently here in Shenzhen in China, and we do a lot of opinion pieces, technology videos and travel and food videos around China. Unfortunately, due to the outbreak of the Omicron variant in China, we're not being able to do so much travel at the moment, also down to my cancer treatment. And I will apologise before I start. I haven't done much content recently because I've been suffering from some sort of quite severe burns on my chest from my radiotherapy treatment. Anyway, today I want to talk about the Shanghai Lockdown and China's dynamic zero COVID policy. So what I want to do in this video, I want to break down some information about the Shanghai Lockdown, and I also want to go into why it's not possible for China to move away from the dynamic zero COVID policy. So first, let's talk about the Shanghai Lockdown. So about 6 or 7 weeks ago, Shanghai went into a city-wide lockdown. Now this was widely reported in Western media, and of course Western media picked up on all the negative aspects, and yes, there were a number of negative aspects. In the early days, it was very difficult for people to get food. People were being taken off to quarantine centres which had not very good conditions because they weren't finished, and people were told that they were going to be locked down for 5 days, and it turns out it's been much longer than that. Now, all of these things are not good. We also had instances where children were being separated from parents, and we also had instances which were widely reported in the Western media about pets being killed. Now, many people in the West think that the Chinese authorities and Chinese government don't listen. But in a number of those cases, for example, the children being separated, there was a big outpouring of dissatisfaction on Chinese social media, and that policy was amended to allow parents to go with their children into quarantine. And the animals situation where animals were being killed, this was again not a government policy, but it was local officials taking things into their own hands, and there has been a lot of work to try and avoid this in the future. And in fact, they've even set up centres, I believe now, where pets can go while their owners are in quarantine. The other thing that I'd like to mention, I have quite a few friends in Shanghai, both foreigners and Chinese people. And from talking to these friends, they're in different areas of Shanghai. It seems that the response and management of the lockdown has varied significantly from area to area. And this means there's some areas that have been much more affected from getting food and essentials than other areas within Shanghai. And I think this is down to local sort of government and officials in certain areas are very nervous about their area having a lot of cases. So some areas are much more cautious than other areas within Shanghai, because obviously if your area there's a large spread or a large outbreak of coronavirus, those people in charge risk getting fired, and that's a issue in China which comes from sort of a top-down management. People are somewhat scared to take responsibility in order to open up. And from speaking to a number of people I know and friends within Shanghai, I think the anger has not come from the lockdown itself. My impression is that a majority of Chinese people are in favour of the lockdown to stop the spread of COVID. I think the anger has come from the sort of mismanagement of certain things within the scenario of the lockdown, like food deliveries. Something else I've picked up while speaking to people throughout the Shanghai lockdown, and this includes myself as well, I get the feeling that Western people are more critical of the lockdown than Chinese people in general. You know, I myself experienced a 7-day lockdown here in Shenzhen, and now we have to have almost continuous testing because we can't get into many buildings unless we show at least a minimum of a 48-hour negative COVID test. And I do find it to be a bit of a pain in the ass, to be honest. But I find that Chinese people are much more accepting of it, and they have the attitude that, oh, well, you know, it has to be done and it's for the good. And I think this is down to the fact that the Chinese culture and Chinese thinking is very much more centered around doing things for the good of the whole community or the whole of the country, where I feel Western views and cultures are more individualistic, like it's more about looking after myself and my own freedom. So I do think there's a big factor there to consider. Now, there are a number of people in China and many Westerners who think the Shanghai lockdown is a complete overreaction, and that Omicron has been allowed to spread in many other countries without huge problems. People see the death rate is lower for Omicron, which is not exactly true. It's just that more people are now vaccinated in the West. But I now want to talk about why one, the Shanghai lockdown has been like it has, and two, why China cannot deviate from a zero COVID policy at this time. And for this, I want to cite a paper, a peer-reviewed paper that's just been published in Nature Medicine. This was conducted by scientists and epidemiologists at Fudan University as well as Indiana University. And they've constructed a model which, based on data from the Shanghai outbreak and other areas of outbreak within China, and they've constructed a model which shows what would happen if Omicron was just left and there was no lockdowns or preventative measures done here in China. And it says the introduction of the Omicron variant in China in March 2022 could have the potential to generate a tsunami of COVID-19 cases. Over a 6-month simulation period, such an epidemic is projected to cause 112.2 million symptomatic cases, 5.1 million hospital admissions, 2.7 million ICU admissions, and 1.6 million deaths, with a major wave occurring between May and July of 2022. And this goes to show you that there would be a significant problem and stress on the health service of China. What you've got to remember is China's health system, especially outside of the major cities, is nowhere near as advanced as that of Western countries. The Chinese authorities are working on making it better, but it will take time. And also, what you've got to remember is just the sheer population of China and some of the Chinese cities, like Shanghai alone. There are 26 million people within China. The report goes on to say the peak demand of ICU beds corresponds to 15.6 times the number of existing ICU beds in China, and the period of shortage of ICU beds would be estimated to last 44 days. And that would be a substantial problem for China. It's basically saying they would need 15.6 times more intensive care beds than they've actually got, which would mean the hospitals would just be crammed full. They wouldn't be able to admit other patients for other things. There would be many people die. And the report then goes on to say, in conclusion, should the Omicron outbreak continue unabated despite a primary vaccination coverage of more than 90% and booster vaccination coverage of more than 40% as of March 2022, we project that the Chinese healthcare system would be overwhelmed with a considerable shortage of ICU beds. So again, the conclusion is that many people would die because there would be a shortage of ICU beds. Now, if you look at the deaths in the Shanghai outbreak, which have been around 600, a vast majority of those have been older people. And although 90% of the Chinese people have been vaccinated, and over 40% have had 3 shots, so more than 90% have had 2 shots, and over 40% have had 3 shots. Where the vaccine rollout has been lacking is in those people over 60, and especially those people over 80. Now, if you take 10% of China's overall population, that is 140 million people. So that's double the population of the UK who are still not vaccinated here in China. So this would have a massive implication if they just let COVID spread like they have in other countries. There will be significant amounts of deaths in China, and that is just not acceptable to both the Chinese people and the Chinese government. Now, I'd like to give you my thoughts on this, and I've noticed this amongst the expat community here in China, that many expats think it's crazy to have all these lockdowns and all this testing. And I must admit, I've also felt that it's a hassle. It's been frustrating that we can't easily travel. It's frustrating to go and have tests every day or two. But now, seeing these numbers in black and white, I really understand why. It is just not acceptable for the government to have 1.6 million deaths on its hands. And I think it's more so frustrating for foreigners because they look back at their own country and they see their own countries opening up. Now, if I take the UK, for instance, the UK have done an extremely good job in getting their population vaccinated. In fact, the older people in the UK were given priority. My parents are 85 and they've already had their 4th vaccine. So a large majority of the older people in the UK have been vaccinated, and this is why they've opened up. However, even though they've opened up, there are still, at this point in time, between 200 and 300 deaths a day, which according to the NHS statistics are attributed to COVID. Now, you can argue about those statistics and how those are measured, but that's what the NHS website are saying. So, but I think that is more sort of in line with let's say a death rate that can be acceptable in order for people to have freedom of movement and travel and etc without any restrictions. Currently, I feel that the area where China haven't done so well is getting the older people vaccinated. But again, there are reasons for that. What you've got to remember is a lot of these older people grew up in times where Western medicine was just not a thing. Vaccines were not a thing. So they are nervous to have the vaccines. And as well as that, you have many old people living in more rural areas where they haven't had any COVID. So it's like those kind of old people are saying, well, why do we need a vaccine? There's no COVID here. And that's because they don't understand how easily the vaccine spreads. I've spoken to many younger Chinese people who've really worked hard to try and convince their parents to take the vaccine, but still those older people, their parents, don't want to take the vaccine. So when do I think China will open up? I honestly think that for the time being, China will continue with this dynamic COVID-0 approach. And I firmly believe that until such time there are vaccines available that give a more long-term immunity, and they have got more of their old people vaccinated, which I think there should be a big drive for here. I do see some regions are even offering sort of cash incentives to old people to get vaccinated, or there's widely availability of the Pfizer antiviral drug like Paxlovid. I really think that China will not open up. So as you know, me and Oliver are leaving China in the not too distant future. We're not doing that because per se of COVID. I've gone through a cancer treatment, as you know, and I'm desperate to see my family. I haven't seen them for almost 3 years, but we are going to take the opportunity while China is still in lockdown to travel some more of Southeast Asia. Anyway, I hope that gives you a better understanding of why China continue to pursue a dynamic zero COVID approach to the Omicron variant. We all hope that they will get some solutions sooner rather than later so China can open up. It's obviously affecting the Chinese economy, but obviously the Chinese government and the authorities here are prioritizing lives over economy, something that a number of other countries have not done. I would ask you to please support our work, either buy us a coffee through Patreon or contributing to us on Alipay. But as always, for now, take care.